The resident training is one of the most vital parts of our department here at the University of Vermont Department of Surgery. Residents are really the lifeblood of our department. We could not care for the patients without them, and all of our faculty who join us here know how important that is to the department. Every case that comes in to the Department of Surgery is a teaching case covered by surgical residents. The training programs that we have here put out excellent technical surgeons, excellent clinicians, and what I'm most proud about is that these are individuals that have the highest ethics and high morals and get along very, very well with patients, families, and referring physicians. Our residencies have been thriving over the last 5 years or so. Specifically, we've been able to increase our categorical residents in general surgery, so where we now graduate 4 categorical residents. We've been able to create a rotation in rural surgery for those individuals who want to consider careers in community practice and have that opportunity to get away from the academic center. We've also been able to create our first fellowship in vascular surgery. So overall, we have really been able to expand the opportunities for our residents so that they have a more complete experience to choose what the appropriate career is for themselves.
The heart of the residency program has to be the people. People here are very kind, passionate, and humble. The people just really care about each other, want to work hard. We need that leader, the teacher, the whole team player. We are still looking forward to the perfect general surgeon, people who leave this program and are ready to operate, who have that skill, the knowledge, the base, and the confidence to go out there and be a good general surgeon. When people leave this program, they don't need an extra year or fellowship to learn how to operate. In the last 5 years, we've had residents match into really top-flight fellowships into a number of different careers, which is really exciting. Our faculty are very dedicated. They're here for a long period of time. They eventually retire from this program. They're amazing role models, they're amazing mentors. They're very invested in the product that we put out there. The operative experience here at UVM is outstanding. We do see a lot of variety of cases. It's our residents doing the cases with the attending. They're not looking over someone else's shoulder. They're not being second scrubbed with a fellow. They're actually hands-on with this patient care process. From seeing the patients in clinic to going multidisciplinary care plans to the operative experience to the post-operative experience. It's absolutely amazing. UVM is very unique. Vermont is very unique. Again, the people here are just very passionate, and they really, really care and want to work together. It's just the nature of the hospital here.
Here at the University of Vermont, the Department of Surgery considers research to be an integral component of its mission. These research activities span bench research into the fundamental mechanisms of the immune response and blood clotting, extend to clinical activities examining the intersection between surgery and the risk of opioid addiction, and incorporate advanced computational modeling and data analysis to study the epidemiology of breast cancer and the complexity of sepsis.
My surgical training here at UVM Medical Center has been phenomenal. The program has allowed me to grow in every way that I could have hoped for. I personally am going into cardiothoracic surgery, which has been a phenomenal experience here, where general surgery residents still rotate on the cardiac surgery service and have an opportunity to participate in those cases. One of the opportunities that I was able to take advantage of during my time here was on my research year. Did a global health trip for 3 weeks to Rwanda with one of our cardiac surgery attendings, participating in an organization called Team Heart, where I was able to go over there and for 2 weeks travel across the country looking for candidates, young adolescents with rheumatic heart disease. And then for the final week and a half, we operated on 16 adolescents with rheumatic valvular disease. One of the unique things about our program is the flexibility of our research year to accommodate your interests. I'm interested in cardiothoracic surgery and surgical care delivery, and I designed my own research year to both work on several cardiac surgery outcome studies, more traditional clinical outcomes projects, as well as supplement my own education, taking a course at Harvard Business School on healthcare delivery. Throughout that year, I was able to get several first author publications. Another accommodation has been the development of both an elective rotation and a rural rotation. We now rotate at a community general hospital, which was something that the program developed in response to requests from residents. The elective rotation is also something that was requested by residents that is new within the last several years. You rotate on an elective of your choice as a fourth-year resident. One of the things that this program has is unbelievable mentorship. There's only 4 residents per year in this program. You get to know your attendings very personally, and the attendings see it as their job to get us to the position that we want following graduation. Now, as a 5th-year resident, I feel like I'm right where I should be in terms of general surgery. I personally want to do and am doing a fellowship in cardiothoracic surgery, but if I was going into general surgery, I feel that at the end of this year, my chief year, I would be ready to enter community general surgery practice. I feel very comfortable taking junior residents through standard general surgery procedures, cholecystectomies, hernias. Those at our institution, by the time you're a chief, are teaching cases. As far as more complex operations, I feel in the OR at my level, we have just the right amount of autonomy with a good amount of oversight when needed.
Prior to my research experience here at UVM, I didn't think I was going to be involved in academics. I was planning on being a rural general surgeon, and while I have not ruled that out, I've definitely found a passion and a motivation really to work with residents, to work with faculty development and med students, both through general education research and simulation education. The first one that comes to mind is as a sim fellow through the ACS-AEI, we were able to implement a pediatric trauma for acute care surgery attendings. So these are adult trauma attendings who have some experience with pediatric trauma and are obviously ATLS certified and very capable, but because they're the ones in-house, they're sometimes the first attendings on scene, the really scary ones that you kind of hope you never see. And the results from that were great. The attendings appreciated it, they felt more prepared, they performed very well. And so as a resident, being able to help my attendings who I look up to as mentors was very empowering and rewarding.
UVM residency has absolutely moved me towards my career goals. I initially thought that I wanted to do general surgery in a community setting, but it's very much opened doors to different possibilities and really points to the program here and the mentorship that we get. It's just so palpably different here on how people interact with each other. It's very much with large amounts of empathy and respect, and we very much respect our attendings here, and they really give us a lot of say in our education and our path forward. Surgical simulation is something that I started to see when I was in medical school, and I think it's been carried forward very well, and especially so in our program. We have a dedicated simulation center and also a dedicated simulation fellowship. We get simulations and things that we have to do like FES and FLS, but we get simulations in patient care, patient scenarios, high acuity patients, especially actor training, which I think is not always utilized. So we actually can interact with live patients. Additionally, we work with cadavers a lot, and so some of the more uncommon procedures like common bile duct explorations that we don't see very much clinically, we can get some practice with, at least getting used to the anatomy in tissues that are more real life. Faculty is very involved in our education here. Once a week, we have an education block of time that's completely protected, and residents really take the ownership of our education, but a faculty member is always present, and they really help guide the discussion of what we're learning, depending on which pathology it is or which area of the body we're talking about. Having the faculty there really makes a big difference, and we often go through case scenarios and oral board situations, which honestly only the faculty member has really all the experience that makes the difference. They're incredibly influential on our education.
When I look back at my training, I think the real heart of our program is the patients. That's the center of this hospital, it's the center of this training program. It's definitely what guides us. And beyond that, the heart of our program is our camaraderie, our excellent work, how well we take care of our patients and work together as a team to do so. My next step is a fellowship in breast surgical oncology. So my interviews are done and my application is all settled, and I realized how well I was prepared by UVM through that process. One of the nicest things about being here over the course of the 6 years is the way our residency's grown with adding more residents to it, expanding our scope to include the rural rotation. Another really nice thing about being here over that time has been to see my chiefs come back as faculty, and I think that really speaks to what a great place this is to work. My residents that have graduated, so many of them have come back, and now they're my attendings and my faculty, and it's been a real treat for me because I looked up to them. My attendings are so available here, and they're so very invested in us being successful, happy, whatever success means to each of us. You know, none of us have the same goals, but the faculty here have been amazing mentors and are so available, so accessible, and invested in having us be successful, happy, and become the best surgeons that we can be.